Hello, folks. It's Andrew again with our Insight of the Week. I know you were looking forward to it. Let's get into it. I'm returning to something that we've done a couple times before, and that is what to expect when you're expecting to have surgery. And this week, I would like to go into lumbar surgery or low back surgery. These can be scary. People usually are a little bit nervous about this one because obviously the spine is kind of scary, and oftentimes it comes with you've had numbness or tingling or pain in the leg, sometimes weakness, and quite often weakness in the leg, which led you to have this surgery. Okay, so don't be scared. We want you to know that we have great success rehabbing these things. So there's a few things that you're going to want to know going into it, and to help manage your expectations, understand what's going to be happening after. So after surgery, you're gonna be in a little bit of pain, of course. So things like ice are gonna be very much so a part of your early rehab and reducing that pain and whatever else the doctor gives you for that. Okay, and there's gonna be certain restrictions. In most lumbar surgeries, the restrictions are commonly referred to as the BLT precautions. That is bending, lifting, twisting. So after surgery, they're not going to want you to do any significant bending of the spine, lifting anything heavy. The exact amounts of how much you're allowed to lift is going to be made clear to you by your doctor. And twisting is going to be another thing that's definitely not going to be something they're going to want you to be doing. Overall, they're not going to want you to be doing too much sitting right after surgery. Same for long periods of time can tend to aggravate things. So those are the things that they're not going to want you to do. There are things that they are going to want you to do, and this is going to get into the rehab portion. You can expect that your physical therapist is going to want to put you on some sort of walking program to get you moving at some point or another early-ish on in the rehab. Exactly when is going to be up to your doctor and your physical therapist. The other thing that you're most likely going to start working on very early on in your rehab is core, and restabilizing your core after that lumbar surgery, getting those muscles to start working again. So that's what to expect when you're expecting to have lumbar surgery. Again, don't be afraid. These things tend to turn out very well. So we wanted to give you guys that information, and that's our Insight of the Week. We'll see you next week.